Hello. Hello, Dr. Priyanka. Hello.
Yes,
Dr.
yes,
Priyanka.
ma'am.
Just see whether now it is visible full screen.
Yeah, it's completely visible now. It's nice.
Nice.
Clear also.
Okay.
Yeah.
There was something wrong. I think 1 minute. Let me change the slide also so that it comes there.
Dr. Arpita? Dr. Arpita?
Yes, Dr. Priyanka.
Yeah, please continue.
Is it okay,
Yeah.
Dr. Priyanka? Okay, now
Yeah,
you can
ma'am.
see the second
Yeah,
slide?
yeah,
Okay.
yeah, ma'am.
Okay, all right.
Everything
Chalo.
is nice. Perfect.
Okay. Chalo, good. Then.
Okay. Hello, everyone. Am I audible, Dr. Priyanka?
Yes, yes, you are audible.
Okay. Hello, everyone, and a very warm and graceful good evening to all of you. Myself, Dr. Arpita Singh, Regional Head of MACS Organization, Gorakhpur Branch. On behalf of our organization, we would like to welcome to all our dignitaries and guests of this evening. It gives me immense pleasure to welcome our chief guest of this evening, a very elegant Dr. Neeta Mishra, ma'am. A small introduction about ma'am is a professor and head of Department of Oral Medicine and Radiology, BBD Lucknow. She had over 60 publications in national and international research journals. She had 20 years of teaching experience, expertise in laser dentistry, oral cancer, tobacco counseling. She has holder of TOYS National Award for Community Service. I request to Dr. Neeta Mishra, ma'am, that please say some words about us or about our organization of this evening.
Thank you so much, Dr. Arpita. You have introduced so nicely, and it's very I'm fortunate to attend this meeting, and I'm a virtual guest for such a nice society that is Max. They're doing so nice for facial aesthetics. People are like very much attracted towards this Max, and upcoming students and the dentist, they are very much interested in skill based learning. So as you all are doing so well, and I'm sure it will take much height in future. So I am very fortunate to be associated with you all. Thank you.
Thank you so much, ma'am. And very, very special thanks that you give your some precious time to us. Thank you, ma'am.
My pleasure. Yeah, thank you.
Okay, now continue the session. We had another a very special guest with us, a very dynamic Dr. Nitin Anand Krishnan sir. He is he work in head and neck department as dental oncologist in Amrita Institute of Medical Sciences. Conduct PG diploma in oral oncology. He treat medically compromised patient. Dr. Nitin Anand sir.
Yes.
Sir,
Yes,
I request you that please come and say some words. Give your blessings to us.
In fact, good evening to one and all. It is actually a great privilege for me to be a part of this program, and mainly this dentofacial aesthetics and its latest trends. And it's indeed an eye-opener to see our specialty open up new areas, and taking the specialty, of course, to a different level actually. And in fact, I would like to thank Dr. Priyanka Yadav, the organizing director, Max Dent Skills, for actually inviting me to this online session. I feel humbled to share the session with Dr. Neeta Mishra, ma'am, and Dr. Jagriti Gupta. And also appreciate the effort taken by all the members in the organizing committee to come up with such an excellent event, and which is of real innovative type. And I wish the participants all the very best, and let this session be fruitful to one and all. Thank you.
Thank you so much, sir.
Right.
Thank you. Now, we have a special announcement of our next 2-month certificate course of Dentofacial Aesthetics. It is conducted in 9 modules, weekly classes, lectures, live demos. And there is hands-on also, which is conducted in Lucknow. Now, without wasting time, I would like to welcome our very, very, very talented and mentor of this evening, Dr. Jagriti Gupta ma'am. A small introduction about her is, she is Masters in Oral and Maxillofacial Pathology, Fellowship in Aesthetic Medicine. Now she is Associate Professor, Department of Oral and Maxillofacial Pathology, Vyas Dental College and Hospital, Jodhpur, Rajasthan. She is a Director of Aesthicos Skin, Hair and Laser Clinic in Lucknow. So I request to Dr. Jagriti Gupta ma'am that please come and start the session.
Thank you so much, Dr. Arpita, and thank you so much, Dr. Priyanka, for organizing such an event. And as rightly said by Dr. Nitin sir, that it is a new venture that people are going and exploring. And thanks to Dr. Neeta ma'am, she is a very good friend and always provided support and guidance to me. So I hope this session will be a fruitful one. So hello everyone, and welcome to this facial aesthetic journey. So first of all, wishing everyone a happy Basant Panchami. So no other day could have been better to launch our certificate course on facial aesthetics and trichology. May Goddess Saraswati bless us all and help us to increase our knowledge day by day. So on this auspicious day, Max Dental Skills, in collaboration with Aestheticos Academy of Facial Aesthetics and Trichology, is launching our 2-month certificate course. And we are very happy to announce that. And I'm inviting everyone to attend the webinar to share your queries regarding the course outline and its application and how it serves to expand your treatment list and knowledge. So as already my introduction has been very nicely given by Dr. Arpita, I'm very much thankful to you. I am oral and maxillofacial pathologist by profession. I'm professor in Vyas Dental College and Hospital, but now I have a major interest in the field of dentofacial cosmetology, and I'm practicing and teaching it with very much enthusiasm. And I want you all to be a part of this venture and expand your knowledge and your treating list. Hope this screen is visible to all.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Okay. It is visible. All right.
Yeah.
So it is defining, rather redefining dentistry. That is, we know the conventional dentistry. So this is a topic that is, we are going to redefine dentistry, or conventional dentistry is already always there. It won't go anywhere. And we are talking beyond that, what else we can achieve along with our regular dentistry procedures. So I wish to take you all to a trip to dentofacial aesthetics, which is a combination of dental as well as facial aspect of the practice. So as the name suggests, dentofacial, it is the use of advanced aesthetic technologies that provides a medically based procedure. So we have to keep in mind that it is a medically based procedure, which is designed to cause a significant cosmetic enhancement or change. Nowadays, dentists worldwide, they are practicing not only about teeth and gum, treating teeth and gum, but they are practicing complete dentofacial aesthetic treatments. So first and foremost, what question arises is, most of the participants or whosoever inquires about the course, the very first question that I am asked is that whether we are eligible, or is it legal, we can do it or not. This is the major question every participant whosoever wants to join the course, they have in their mind. That is, they are worried whether it is included in a curriculum, in the BDS syllabus or not. So I suggest everyone to today, after this completion of the webinar, you must go and download the syllabus of DCI. It is very much written that you should Everybody knows it. Only thing is that we have forgotten. We are not aware of it. It is very much written that you should have to have a complete knowledge of facial aesthetic, facial anatomy, muscles, and about the injection techniques. So there's no question whether a BDS or MDS or any other medical practitioner can practice this, or they require some special degree for it. So I hope this suffices the question answer to your questions. And next is, which degree should I go for? Affiliation. They are worried about affiliation, whether it should be from a foreign degree or from which university it should be associated. So there's nothing as such. It is just a skill development program, right? Because already you have been practicing dental treatments, which involves the proper knowledge and precise knowledge of facial anatomy as well as injection techniques. So there is no need of running after a higher degree, expensive degree, foreign degree, anything like that. Basic requirement is a medical or a dental degree. You just need to upgrade your skill. Already you know how to inject. We all have been injecting. I think the major gathering is of dentists over here. So we all are giving intraoral injections, which is much more difficult. You ask your medical friends, they are not able to inject intraorally. Okay, it is very difficult for them. When we can master that, then we can obviously do that extraoral injection also. So it is just a proper training or skill, as very well told by this dental skill update, the program. So it is just enhancing or growing your skills. So it is through various certification programs. Like if you go for implant programs or laser programs, you don't need a special degree. It is just that you have to hone your skills. You have to improve yourself. You have to upgrade yourself. What you need is just a good mentor who can guide you, who can understand you, what are your shortcomings and where you are lacking. Just you need to enhance that. Okay, so there's no worrying of any degree or affiliation. It's not that if you get a foreign degree, you'll become master and on day one, you'll strike the whole country. It's not like that. आपने यहाँ से भी डिग्री करी है, कहीं से भी properly learn किया है, तो you can do a proper treatment. So it is that not just MBBS, BDS, BHMS, BMS, anybody who is a registered medical practitioner, MDS. I have also trained many dermatologists in this field, because these procedures are not taught. So nowadays, the trend is that the patient wants complete, like a patient goes to a dermatologist, they'll treat for acne. But what about the scars? What about that collagen thickening, that fibrosis? For that, you need to perform certain procedures. That is not there in the curriculum right now in the dermatology also. So for that, a special branch of cosmetology is there in which you can learn such things. Okay. So next question, what arises is, what does this field require lots of technicalities? So no technicalities as such, which is very high. But yeah, basic knowledge of anatomy and physiology is must, which we have already been taught in first year of our BDS curriculum. Although most of us tend to forget it with the passing of time, but in a basic, this knowledge of facial anatomy and physiology is must. And injection techniques like IV, IM, these are also a part of our syllabus. You can refer to your DCI syllabus. So you should be able to perform the injection techniques as well. And what about people are worried whether we can give botulinum toxin, we can inject, it is a toxin, we should do or we should not do. So if you can administer any injection or you can prescribe any antibiotic just because you are a medical practitioner and it is written on the label. If you see the label or any antibiotic or any tablet, then you will see it is written there to be administered or prescribed by a registered medical practitioner. So when you can prescribe any antibiotic or any painkiller and any injections like Voveron or Hylase injections like we use for OSMF, so why not you can inject botulinum toxin and dermal fillers? The same botulinum toxin and the fillers can be used for reducing the gummy smile. Then why not for the other areas of the face, which can enhance or cosmetically enhance one's beauty, or they can address the concerns of the aging patients. Many other cosmetology procedures like threads, thread lift, you must have heard. Whosoever have little knowledge of the cosmetic field, thoda bhi agar knowledge hai to thread lift suna hoga. So like threads, microdermabrasion, mesotherapy, etc. These are evidence-based medicine. Evidence-based medicine, that is, they do not require any certification. Anybody can do. You need not to have even any medical degree for that. Okay, so you do not need any certification for that. Does it require huge investment? So no, it does not require huge investment unless you want to go in for a fully established high-end clinic. It can be started with minimum investment in your existing clinical setup. Like you already have your clinical setup of a dentistry, dental clinics. In that setup itself, you can start with your aesthetic procedures. Like if you're not ready to install any machine, then with the help of consumables, like you buy the botulinum toxin product or dermal fillers, you inject it, you provide the treatment and you charge for it. So there is no your investment is somewhere kept up, or you're not getting the proper ROI, not getting the return of your investment. It's not like that. Initially, if you are not willing to install any of the machines, then you can start with the consumables like threads and dermal fillers and botulinum toxin, etc. Okay. So next the question arises, what is the scope or what is the career in field of cosmetology? The best answer is the dentists have an edge in this field because we can treat the complete dentofacial part. The others can only treat the facial part. We, being a dentist, can also address the concerns of the dental abnormalities, that is including prognathism if a person has, or short lip, gummy smile, gingival pigmentation, competent lips, all these things, or some crooked teeth or discolored teeth. Many things dental treatment is done, and along with that, if you also do the facial treatment, it will give a enhanced treatment or an enhanced appearance to the patient. So here we have an edge. The dentists have an edge over other professionals. So it is a very promising career for youth, as very rightly said by Dr. Nitin sir, that nowadays it is a very promising career, and one must look for other venues as well. So this is another avenue. And because of the advancement in lifestyle, nowadays everybody wants to look good, beautiful, and in a much affordable cost. And as per data, India is a growing market in terms of aesthetic medicine and treatment. It is expanding vastly year by year. So dentists are nowadays undergoing comprehensive training to be able to offer everything from Botox and dermal filler injections through to chemical peels, microneedling, PRP, PRF, that is platelet-rich plasma, platelet-rich fibrin, which we do for wound healing or for socket healing, and laser skin rejuvenation, and many more. So as I already told, why dentists? Dentists are the most appropriate personnel to master in facial aesthetics. They have a detailed knowledge and training in treating the orofacial region and its diseases. They have unparalleled knowledge of facial nerves and vessels. So the major concern is that you should not look for only certificates. You should not run after the certificates or international degree or affiliation. Kahan se affiliated hai? Aisa nahi hai. Usko aap when patient comes to you, he will not ask ki kaun si degree, doctor apni degree dikhao, then I will get the treatment done. Dental mein bhi ye nahi hota ki aapne kahan se liya hua hai, pehle degree dikhao aap. So it's your capability, your skill. So that can only be with the help of good mentor. Okay. Or a good mentor, Google cannot be a good mentor. Google can only guide you. It can only give you a little knowledge when you already have some knowledge. Then you can take assistance from Google, but by seeing on Google and you're trying to do it yourself, that causes a problem. That may cause legal issues when you do the things wrong. So mentoring is the major part of this. It is not about certification or about degree or affiliation or international degree. It is the mentoring. Who is your mentor? Because mentor needs to see your capabilities, your shortcomings, and to try to train you according to your shortcomings. Okay, and keep motivating you and give you the right advice at right time. And thus you can achieve your goal and achieve success in your practice. So it's always good to keep learning. It's not the end. So many things, one of the major things that we can do, achieve with the help of Botox and fillers is liquid facelift. That is, it is a non-invasive facelift without surgery. You need not to do, like oral surgeons, obviously they can perform the surgeries, but a BDS or any other professional without surgeries, only with the help of injections like botulinum toxin and dermal fillers, they can do, and also threads, they can do a complete facelift or facial rejuvenation. So there is various applications of injectables in dentistry in the orofacial region as well. And it continues to grow. And the dentists nowadays are very much interested in expanding their practice and are also benefiting from this systematic approach. Now, we already discussed that the dentists are specialists in head and neck area, and they have a proper knowledge of cephalometry and facial aesthetics. And facial injectables is a natural appendix to existing scope of practice. And it continues to expansion in dental offices now across the countries, which is the major trend nowadays. So imagine there are two dental clinics, dental clinic A and dental clinic B. So you already are doing the various conventional dental treatments like scaling, extractions, restorations, crown and bridge, denture, RCT, listed whatever you can master. And along with that, if you also upgrade your skill and learn a few more techniques like Botox, botulinum toxin, dermal fillers, laser treatment, and PRP, PRFs, this is expanding your treatment list. So when dentist A can perform only these regular treatments and dentist B can perform both the treatments, so better dentofacial, complete dentofacial aesthetic treatment can be provided by dentist B. So obviously the patients will be more attracted to dentist B rather than dentist A. So if you see, if a patient comes to you and you are doing the dental treatment, along with that, if you the patient has this vertical lip lines or have a deep nasolabial fold or marionette lines, and you can solve these problems as well, then only you can establish a complete smile designing. Have kept people keep the name of the clinic as smile designing clinic, but it is not smile designing. In literal sense, it is just the tooth designing. You are just addressing to the tooth part. You are not doing anything with the musculature or the surrounding perioral areas. Okay, so if you can cater, if you can treat these areas and make the patient look younger and the smile more beautiful, nothing like that, than that. So as you already we have seen, the 47% of people when they meet someone, they see their smile. So it is a very big value. So botulinum toxin in dentistry can be used to reduce the gummy smile. Like you must have seen the people, when some people smile, much of the gingiva is exposed. And this can be helped with the help of botulinum toxin and along with some dermal fillers. If the lip is very thin, then you can increase the thickness of the lip along with the help of dermal fillers. Okay, Masseter hypertrophy, you can see the difference, how this chin or this area is looking. And now after this botulinum toxin injections, how the muscles have relaxed. And in various Trismus and TMJ disorders, bruxism and trigeminal neuralgia. So all these can also be treated with the help of botulinum toxin. So as I told you, smile designing is an art comprising of both hard and soft tissues. It is not just about hard tissue, that is the teeth. It is both white and pink part, and also the extraoral part. It is a dynamic relation of facial muscles as well as tooth and the gingival display. So we have to have a balance of this to make a smile more appealing, beautiful, and the face cosmetically beautiful. So these gummy smile correction, lip augmentation, masseter and mentalis treatment, chin advancement, and lengthening, these all can be achieved with the help of neuromodulators, that is botulinum toxin and soft tissue filler. So this, after learning this, you can expand your list of treatment as well. See, that was the dental part. Coming on to the facial part, see, you can see the difference. You can see the nasolabial, deep nasolabial fold, and you can compare this side with this side. This is the side where I have done the filler, dermal filler, and you see it looks more rejuvenated, more attractive than this part. So when you can inject the fillers over here or over here, why not here? You can inject here as well. Similarly, for under eye, you can see the immediate difference after the injection. This tear trough area is treated with the help of dermal fillers. Next, botulinum toxin can be used to ease out your frown lines. PRP, PRF can promote healing drastically. You can see this was the patient who had come to us, and she was a diabetic patient. She had taken dressings and everything. She was taking the antibiotic also, but it was of no use. But when she came to us, I did this thing, PRF therapy, not PRP, PRF therapy, and week after week, you can see the result like this. And no antibiotic, nothing was given. This was just, this is a regenerative medicine in which the healing is done with the help of your autologous blood. Similarly, you can do treatment for hair therapy with the help of PRP. You can see the amount of hair growth. Next, you already have laser. Some of you have laser in your clinic for surgical process. You can do with the same laser, you can do mole or tag removal. See, mole or tag removal, which also gives the instant result. And another treatment with the help of laser, different type of lasers are there which can help in removal of the acne marks. Now, this is also removal of the acne and acne marks. This is all you can do. Skin lighting and brightening treatment can be achieved with various procedures. You can see the effect of peel. This was an accident case in which her anteriors were broken, and then this all was fractured, and there was soft tissue laceration. So after healing, we did microdermabrasion. The final picture is not there, but she recovered very nicely. Another treatment is micropigmentation, in which if you have some bald spots or there is alopecia of any kind, and the patient is not ready for transplant, or if it is a very small area, then you can do micropigmentation technique to camouflage that area. So this is the academy. This is the course outline in which you are taught about the botulinum toxin, dermal fillers, threads, both. There are two types of threads, PDO and COG thread, both are taught, chemical peels, about the acne therapy, PRP and PRF, that is platelet-rich plasma and platelet-rich fibrin, microneedling technique, lasers, various kind of lasers, and IPL and Nd:YAG laser, subcision and brightening. Subcision is a very good technique. And skin brightening and lighting, microdermabrasion, mesotherapy, and tattoo removal. All these are covered under this course. So what you have to look for is a good mentor who is approachable, and you should have to start from the basics, and workshops or hands-on are also done. Complete theory is covered, and complete product knowledge is given to you. Also the knowledge of the equipments or machines that are being used in the clinic for aesthetic treatment, and various other ease of establishment and the complete support on online or WhatsApp. These are available. So various people have done. Another course is, this is different from aesthetic and trichology. This is a micropigmentation course in which you can also do camouflage for vitiligo patients, wherein you see white patches or there. You can do this biomedical tattooing or micropigmentation. Similarly, you can do for scalp or any scars or stretch marks. This can be camouflaged with the help of. So for any query, this is my number, and you can contact Max Dental Skills as well. And this ends my session, and you're free to ask me any question, and I'm here to answer all your queries. Thank you so much.
Thank you so much, ma'am, for clearing our doubts so nicely. And it is very informative, our introductory lecture. Thank you, Jagriti ma'am. And I
Thank you,
request
Dr.
to
Arpita.
all the members who joined this, if there is any query, so ma'am's number is also there, and you will all mail on our email address, MACS. Now I'd request to our Director of MACS, Dr. Priyanka Yadav, that please come and say some thanks to Dr. Jagriti Gupta ma'am.
Thank you, Dr. Arpita. Thank you, Dr. Jagriti Gupta ma'am. She is my teacher also. And I'm so happy to see Dr. Neeta Mishra ma'am. And actually, I had no idea that Dr. Pradyum sir is ma'am's husband also. Last time sir came in our as a guest in our webinar. Thank you so much, ma'am. And you are looking so pretty also. And I must say thanks to Dr. Nitin Anand sir from Amrita Institute, Kochi. Sir is with us. And thanks to our all participants. And if anybody has any query related to our certificate course, you can send a message to us in our chat box. Ma'am is with us. So if you have any queries, any doubts, you may ask. Thank you.
I think Dr. Jagriti has told so nicely that people have no queries. They have excellent. She's an excellent teacher, and very nicely she had explained everything, and all
Yes, ma'am.
small things has been covered up. So
Yeah.
people are not, actually,
Thank you so much, ma'am. But I'm still open to the questions.
yeah.
And
Yeah.
I'm expecting some queries to pour in so that I can satisfy them.
Yeah.
Yes, some Achyut has raised hand. Achyuta Sharma.
Good evening, ma'am. हेलो
Hello. Yes. Good evening, Dr. Akshay.
हाँ हाँ मैम ये जानना चाह रहा था मैं कि जैसे पीआरपी जब निकालते हैं तो उसका जो है बेस्ट मेथड और बेस्ट ट्यूब कौन सी होती है हेयर के लिए?
हेयर के लिए अलग से पीआरपी ट्यूब्स आते हैं along with biotin.
मतलब बायोटिन के साथ एसिडी जेल के साथ मतलब
in which you have biotin also. Biotin के साथ.
बायोटिन के साथ मतलब बेस्ट रहता है पीआरपी ट्यूब. और जो मैम जैसे नॉर्मल जो ट्यूब आता है सोडियम साइट्रेट के साथ हम लोग यूज करते हैं उसमें और इसमें क्या डिफरेंसेस रहते हैं?
किसमें?
जो नॉर्मल ट्यूब आते हैं सोडियम साइट्रेट के साथ जो है एंटीकोगुलेंट और
इसमें एडेड बायोटिन होता है. बायोटिन इज एडवाइज्ड. इट इज acts as this thing an adjunct to increase the hair growth. Okay, so इसमें already biotin होता है.
एसिडी जेल आता है उसका क्या मतलब वर्क रहता है?
Anticoagulant. That is an anticoagulant.
एसिडी जेल का मतलब मेन जो है बायोटिन ही है. तो बायोटिन क्या जी मैम क्या बायोटिन जो है हम जैसे जो सोडियम साइट्रेट का नॉर्मल जो ट्यूब आता है उसमें बायोटिन ऐड करके क्या हम कर सकते हैं? नहीं,
आप बाहर से करके नहीं कर सकते. इट इज ऑलरेडी देयर. आप बायोटिन सप्लीमेंट्स दे सकते हो पेशेंट को, ठीक है, इन द फॉर्म ऑफ टैबलेट्स. दैट इज आल्सो अवेलेबल.
Dr. Arpita, there is one question. Dr. Priyanka Solanki asked in our chat box. Ma'am.
Yes.
Yeah, there's a question.
Yes, please.
In our
ask
chat
me the
box.
question.
Yeah.
Can you ask the question? Can you read out the question, please?
Yes, ma'am. The question is, what is subcision?
Okay, subcision is a medical procedure in which, with the help of a syringe, a needle, 18 gauge or a very thick needle, we just cut the fibrosis. We must have seen scars. कभी भी cut हो जाता है, accident हो जाता है, तो face पे या कहीं पे भी scar पड़ जाते हैं, या acne के scars पड़ जाते हैं, ठीक है? तो with the help of those, after giving anesthesia, with the help of a needle, thick needle, 18 gauge needle, we just remove the fibrosis and the scar is relieved. After that, you can always give PRP or dermal fillers so that it doesn't sink in again.
Thank you, ma'am. I guess there is no question. All are satisfied with ma'am's wonderful presentation.
Hope so. They are satisfied. Hope so. Nobody was sleeping and they don't have a question because of that.
No. Yeah, because you very nicely you presented, and thank you, ma'am. And thanks to our all participants, our guest of today's session. Thank you each and everyone. Thanks.
Thank you and good luck, everyone. Thank you.
Thank you, ma'am. Good luck.
Okay. Bye-bye.
Jagriti, thank you, everyone. Thank you, Max.
Thank you, ma'am. Thank you, ma'am. One more question. Okay.
Please, come on. Go on.
So you can mail us.
You can ask. I'm there for 5 more minutes. If anybody has a question, they can go on. No problems.
Yeah.
Ma'am, it's about course duration and fees. So
that's so Dr. Priyanka, you can talk to Dr. Priyanka.
Yeah, Dr. Arpita, you have can tell.
Regarding the course and fees, you can contact Dr. Priyanka or Dr. Arpita.
You can given numbers. Yes, ma'am. Okay.
Anything else?
Nothing, ma'am. There is no any other question.
So nothing from your side as well, Dr. Arpita. I think you are practicing aesthetics.
Yes, ma'am.
Nothing from your side? No queries?
No, I'll come to you, ma'am. No?
Yeah.
I'll join the course.
That's better.
Yes, ma'am.
Okay, it was a very nice session.
Thank you. Thank you, ma'am. Thank you.
Thank you.
Okay.
Okay.
Thank you so much. Thank you so much, ma'am. It was a very fruitful session. And especially in today's world, when people they give much importance to appearance and aesthetics, I feel it's high time that we as dentists must broaden our spectrum, I believe. And I think you have taken it in the right way. And I believe you have explained all the pros and cons about everything. And I think everybody, they have a clarity about facial aesthetics, and let it be an encouragement for all. Thank you so much, ma'am. Thank you for the
Thank you
excellent
so much, sir. Thank you. Thank you for kind words, sir.
Thank you, Dr. Nitin.
Yeah, thank you.
It is so nice to see fan over there, because in North we are chilling.
Exactly.
Here it's pretty hot. The climate here, it keeps changing every day. It becomes hot.
We feel like going there.
Yeah.
Okay, ma'am. Nice meeting you. Thank you so much, ma'am.
Thank you.
Thank you, sir. Thank you, sir. Thank you, sir.
Thank you.